Americans were sharply divided over the public health response to COVID-19. Things like masking, remote learning, business closures, and later, vaccines. 5 years on from the start of the pandemic, Judy Woodruff recently sat down with two people on opposing sides of that divide, trying to figure out how to move forward as part of her series, America at a Crossroads.
I'll be honest, the first conversation, I thought, this is never going to work. This guy has such strong opinions that are so different than my strong opinions that it's going to be tough here to see if we can understand each other or try to find common ground.
Being a blue-collar guy from the Midwest, somebody that is completely separated from everything going on here in D.C. and things like that, I thought it was a very interesting concept, but I'm one that would have a conversation with anybody, so I'm like, yeah, let's make this happen.
Dr. Francis Collins has spent his life in medicine and research, a physician geneticist who led the project to successfully map the human genome in 2003 before serving as director of the National Institutes of Health from 2009 to 2021. Wilk Wilkinson is a career truck driver who now manages a team of drivers in rural Minnesota, and in his spare time hosts a podcast called Derate the Hate.
Even the people with the best of intentions, often find they have these unconscious biases.
To engage with people across the political divide. In 2022, they were brought together through Braver Angels, a national nonprofit that pairs people across that divide together to engage in civil discourse about difficult issues. That was the beginning of their friendship, and the two recently met again at Collins' home near Washington.
You don't try to change minds, you just try to open them.
Where Collins explained that after stepping down as NIH director, he wanted to better understand why so many people were so upset by the actions he and others in government took during the pandemic.
It's the worst pandemic in more than a century. Thousands of people dying every day in those days in 2020 before we had a vaccine. And we were doing the best we could. And it felt kind of hard to be criticized for sometimes making recommendations that we had to revise later because we got more data. So I was probably on the defensive side. And it was really part of my goal in having these conversations with Wilk as part of Braver Angels to try to get past that and to try to understand how these good, honorable people all over the country were not as impressed with some of the things that we had been recommending and putting into place.
Wilkinson says he's sympathetic to the difficult position Collins was in, and that at first, everyone he knew was on board with those measures.
After a while, it ceased to make sense. We just weren't seeing the kind of things in outstate Minnesota, rural Minnesota, that other people were seeing in New York City or different metropolitan areas throughout the country. So once people started to see that their lived experience and the things that they were experiencing in their communities were not the same things that they were seeing on the news, and the 24/7 fear-mongering and things like that was happening on the news just did not comport with the things that they were seeing in their communities, you could see trust within our institutions dropping it was painful.
And this notion of one size fits all, was that just assumed from the beginning that if we're going to do this for anybody, we got to put these recommendations out there for everybody? Was that?
Yeah, I think it was assumed that was the default. There are a number of background things here that got in the way of being more effective in that space. One was the data collection in the United States was much, much less effective than it was in lots of other countries in the world. Our whole public health apparatus across the US had been allowed to get very much underfunded and understaffed. And so I would love if in Minnesota there had been in every community a public health person saying, here's what's happening here, let's adjust the plan on the basis of our experience. That data wasn't coming in. So at that time the thing was, well, let's just do everything and hopefully it'll settle out.
Another point Collins and Wilkinson agree on, trust was damaged very early in the pandemic when officials first told Americans they didn't need to wear masks and then reversed themselves. Collins explained that with two earlier coronaviruses, SARS and MERS, patients weren't infectious until they got very sick, and so masks weren't needed for people without symptoms.
It was one of those horrible moments in the whole history of what we were going through, realizing that actually there are lots and lots of people who are feeling perfectly fine, who are super spreaders and are passing this virus to anybody close by. And then, oh my gosh, we've got to insist then that everybody start wearing a mask. But we did a poor job of explaining that. This is another lesson, I think.
There was no explanation to, middle America that the data is going to change. Things are going to change. We are going to have to course correct based on the information we have at the time. That was never said, but there was this kind of dictate from on high kind of message coming out on our televisions, saying, you're going to do this, and all of a sudden this changed by tomorrow or by next week or whatever.
And Wilkinson says that mistrust would later extend to the vaccines as well.
Now all of a sudden you'd introduce a thing like vaccines and people are like, okay, well, this is different than putting on a mask. Now they're wanting me to inject this thing that may or may not be completely understood into my kid, into my arm.
How much thought was being given to how do we explain this to people that we've done this really fast and yet it's still safe?
Not nearly enough thought, not nearly enough sort of research to understand the science of science communication and how do you effectively convey information to people that is going to be really important for their decision making. And of course it did work. Let's be clear. The estimates are probably 3.2 million lives were saved in the United States alone by that vaccine. But a bunch of people didn't want it. And the estimates are also that maybe 234,000 people died unnecessarily because we had not convinced them that this was something they wanted for themselves or their families, even though from my scientist brain, this was like so clear.
Collins pointed out that there was often more than one messenger in the White House, the Centers for Disease Control and Prevention, the NIH, leading to more confusion.
I think the other thing to remember is that even going into COVID, we already had a very polarized country. So here you have the public health effort to try to put out here's what we know. Meanwhile, there's a vast universe of other messages coming at people from social media, from cable news, from somebody who heard something down the street and thinks you should know about.
Overnight, there came to be all of these people who yesterday they were a fantastic plumber, but today they've got the skinny on everything having to do with science and COVID, right? A lot of times it comes down to who do you trust, who do you believe, and we, again, as a society, often put our trust in people who maybe haven't earned it, but have somehow acquired it.
Looking ahead, both Collins and Wilkinson agree that work needs to be done now, before the next public health crisis, to rebuild trust and to rebuild communities.
We need to get out amongst the communities again. We need to talk to our neighbors. We need to engage our family members in uncomfortable conversations, but understand that you can approach a contentious topic in a non-contentious way.
I think Wilkes totally got it right. I don't think we're going to see a solution to our polarization, our divisiveness, our America at the crossroads that you're highlighting, coming from the politicians. They're more polarized than the public is. I don't think it's necessarily going to come from the media because many of the media has already adapted a particular perspective that fits in the bubble, that's making the bubble even more tightly enclosed. I think it's going to come from we the people, Judy.
Absolutely.
And we the people, like Wilk and me, getting to the point of really spending time understanding each other's perspective. Not that we completely agree on everything. I think he's wrong about stuff, and I'm sure he thinks I am too. I think we could get there. It won't happen overnight. It's going to be a huge enterprise, but that's our best hope. That's what Americans have generally done in the past. Let's try to do that again.
Advice from two people still trying to find common ground in a divided era. For the PBS NewsHour, I'm Judy Woodruff in Washington.